how important is mental and emotional wellness when it comes to dealing with major health challenges from your
I think
experience?
yeah, I think it's so important, but often the focus is on the physical health challenge. But so often folks are going through a lot of changes, and with said changes, there can be the experiences of grief, but we don't name it that. We just kind of go
Mm.
along to, heal or feel better or move through it so we can literally feel better. But I think there's something to acknowledge the grief that comes with that. There's changes in your body, there's changes in relationships, there's changes to identity. A lot of times when we go through these health challenges or health changes, it shakes up who I am and how I show up in the world. That's a part of your mental health.
Yeah, and the the thing that occurred to me in my experience was that my body had gone through or is still going through a major experience, an invasion of your body. And coupled with that was for many people, the traumatic experience of hearing that you have cancer or heart disease or hypertension, whatever that major health issue is. So you hear that, right? And your mind begins to process it. Then you go through this physical experience of surgery or radiation or whatever the treatment was. And now you're in recovery. But there hasn't been much discussion along the way with the healthcare professionals about the emotional and mental changes that are happening in those three phases: so diagnosis, treatment, and recovery.
Yeah, and with that, there's the ebbs and flows of that, the shifts within relationships. So I know I'm working with someone individually going through changes in life, just general life changes. A lot of that, their independence took an impact, right? And so now the question is how do we look for your independence, but in a way that shifts that it's okay to ask for help. It's okay to have that additional support and it doesn't take away from your masculinity. Because so often we're challenging cultural and those social norms that older gentlemen might have a rigid thought around. Like I'm supposed to be the man of the house, or I'm supposed to show up this way, or I'm supposed to be this to my family. And here it is, I have to rely on my family to help me with certain things. Does that impact you and your role in these folks' lives? Probably not. But how do we unlearn that social conditioning that has actually been a detriment to Black men
Mhm.
versus it actually healing or moving us forward in the aspect of emotional and mental wellness?